Good morning. Welcome to the Gum Guy channel. My name is Greg Meyers, and I am the Gum Guy, and I'm a periodontist, and I specialize in periodontal disease and dental implants. Today's inaugural video is going to be about oral hygiene instruction. I chose this video specifically because I feel it's one of the most valuable things I can tell you and my patients. It's something you can use every day for the rest of your life, and it's something that helps your oral health and your overall systemic health. I'm going to go over the sequence of events that you should be practicing 2 to 3 times a day. So you should be flossing, brushing, and rinsing with a mouth rinse or a water pick for 2 to 3 minutes each session. To first demonstrate the flossing technique, you can use the regular string floss out of the box or the ones that are already pre-lined up. It doesn't matter to me as long as you're using them effectively. For the string floss, which I like the best, tear off a big piece. Start by wrapping it around your middle fingers like this, and then you're going to use your index fingers and your thumb to maneuver it around the tooth. I'm going to first show on this large model exactly what I mean. Now here's the technique for the flossing, which I recommend you start with. Wrapping around your middle fingers, use your index finger and your thumb, make a letter C shape around the tooth, and you're going to go up and down the root surface. Think about getting this plaque up and out of that pocket so that with a toothbrush or rinse, you can flush it out. So pull it against the tooth, go up and down 2 or 3 times, just down to the gum tissue. You don't want to push too hard and cut the gums, but just try and go as deep as you can without causing damage to the tissue and bring that plaque up and out of there. After you're done with this side of the tooth, you're going to go to the other side, make a reverse C-shaped, and go up and down. Up and down is a technique. You don't want to go side to side, a seesaw, and cut the plaque in half. Now I'm going to show you on this more life-size model. Again, wrapping around your middle fingers, use your index finger and your thumb, pull it against the tooth, make that letter C-shaped, and then go up and down the tooth and root surface. 3 or 4 times till you get that plaque up and out. Again, you don't want to slingshot side to side, seesaw, because you're only separating the top half of the plaque from the lower plaque. You're not getting it out. Just think in your mind, get it up and out. You're going to go to the next, in between the next 2 teeth, make that reverse C shape, use your thumbs instead of your index fingers this time, and go slowly and surely up and down that side of the tooth along the tooth and root surface. Again, not seesawing side to side, but up and down. Without removing the floss, go to the next tooth, the next side, the regular C shape with the index fingers, go up and down. Come out of the contact, go through, reverse it, use the thumbs in the other direction. If you're going through the area and you have a real tight contact and you can't get the floss in and out, you can let go from the one side and just pull it through. So you want to do that in between all your teeth, both the lower teeth and the upper teeth. The second step in the daily oral hygiene care is toothbrushing. You can use a regular manual toothbrush or an electric toothbrush. I find an electric toothbrush to be more effective and more consistent. When using an electric toothbrush, you divide the mouth into 4 quadrants. You don't want to grab it with your fist and brush back and forth. Hold it gently, lightly with your fingertips and guide it back. So start in the midline, either upper or lower arch. Place it right at the gum line. Press the button and slowly guide it back. Spend 1 to 2 seconds per tooth going all the way back and then all the way to the front. So without the motor, which you want to just keep it right here at the gum line. You don't want to go over the gums and you don't want to brush up and down or side to side. Just place it right at the gum line. Let the technology direct the bristles with the right amount of force in the right direction for you. You just guide it along. Slow and steady, going to the very back, coming back to the front. When you get to the starting point, you're going to rotate the toothbrush 90 degrees and then slow and steady brush the top chewing surfaces of the teeth. 1 to 2 seconds going all the way to the back, coming back to the front. Slow and steady, letting the bristles do their work. When you get to the midline, you're going to rotate the brush again and then go along the lingual or back surfaces, coming all the way in the back. 45 degrees towards the tooth and the gums, and an angle, and you go slow and steady circles, coming all the way back to the very farthest tooth, and then come back again to the midlines. Slow and steady circles. The electric toothbrush will do that for you, but you can do it with the manual. It just takes more work. When you get back to the midline, rotate it again up over the chewing surfaces, and again, slow and steady circles, letting the bristles be effective. Go all the way back and come to the front. And then again on the tongue or lip side, slow and steady. Third step in the daily home care routine is using a water pick or mouth rinse. Now, I prefer to use a water pick, but mouth rinses work well, and let me show you why. So after you've flossed and brought all this plaque and calculus up to the surface, and then use the electric toothbrush or the manual to brush it all away, sometimes there's still some food and plaque that's still trapped in between the gum line. And that's what a water pick is most effective in doing, is removing anything left behind. Mouth rinse is great, especially if you use it for 30 seconds. It'll coat all the tooth and surfaces of the gum tissue, but it only penetrates about 4% of the pocket around there. So it won't get to these deeper areas. And that's why a water pick is much more effective, kind of power washing and removing anything that's still trapped in there. Some have a big handle with a small tip that you can direct right into that space there. Some have a bigger base with a smaller handle. I think this works great, and that'll direct right in that space in between the teeth and above the gums. That'll flush out any plaque or food that's trapped there. I want to direct that flow of water in between the teeth. You don't want to direct it straight down the gums and pack any food or bacteria in the pocket. You want to come up here in between the teeth and flush it all the way through. So start in the back, go to each site, coming forward and around, and then try to do it, if you have the time, from the back of the teeth flushing out as well. All the way around, both your lower teeth and the upper teeth. Thank you for watching my video on oral hygiene instruction and daily plaque control. Don't forget to hit that subscribe button at the end, and I'll see you next time with our next topic.